Assalamualaikum. My name is NURUL BINTI HASHIM from class RSR 2433C. So in this video today, I'm going to present about anatomy of spine injury. As we all know, human body consists of 33 bones, or call it as vertebrae, which is separated by intervertebral discs. These vertebrae had been divided into 5 different parts, which is cervical vertebrae, thoracic, lumbar spine section, sacrum and coccyx bones. So we will go to one by one. Firstly is cervical vertebrae. It is the most superior portion of the vertebral column that lying between cranium and thoracic vertebrae. Cervical spine consists of 7 distinct vertebrae, and 2 of which are given a unique names, which is the first cervical vertebrae C1 is known as the atlas, and the second cervical spine C2 is known as axis. The second one is thoracic vertebrae. It composes the middle segment of the vertebral column. There are group of 12 small bones that form the vertebral spine in the upper trunk. They form the region of the spinal column inferior to the cervical vertebrae of the neck and superior to the lumbar vertebrae of the lower back. Next, lumbar vertebrae are bones that make up the spinal column or backbone, which is specifically within the lower.
The test that we can do if we have the common injury at our spine, which is pulling test at the cervical spine, and the second one is the scoper test at the lumbar spine, and then slump test at the thoracic spine, and then femoral stress test at the lumbar spine, Faber test at hip, lumbar and sacroiliac region, and the last one is the Lassage test, which is at the sacroiliac region. Okay, thank you.
Do's and don'ts while conducting the test. The first one for the do's is wash your hand before and after the test. The don'ts for this first one is not maintaining good hygiene before, during and after the test. The second one for the do's is briefing to the subject about the procedure of the test. And the don'ts for the second one is not asking for subject consent before begin the test. The third one for the do's is slowly and carefully. This means be gentle with the patient or subject while doing the procedure of the test. And the third don'ts is not aware of subject reaction to the test, which means their pain during the examination.
Okay, so today I will show you how to do a slump test. Okay, let's go. The first step, we must make sure patient is sit upright with hands held together behind his back. Flex his slump, followed by neck flexion. For the next step, we place our hand on top of head and has the patient perform knee extension and dorsiflexion of foot. For the last step, we told the patient to return the neck to neutral. Okay, this test is considered positive if symptoms are increased in the slump position and decrease as the patient move out of neck flexion. Okay. The purpose for this test is to assess whether a herniated disc, neurotension or altered neurodynamic are contributing to the patient's symptom.
Today, I'm gonna share you about common injury that happen at lumbar vertebra. So, the injury are known as ankylosing spondylitis. Ankylosing spondylitis happen when it destroys the nappy articular tissue or joint tissue, and then the original and new cartilage are replaced by bone through fusion. And this causes fusion or joining up of the joint bone, become stiffness and or mobility. So, we can see difference between healthy spine and spine with ankylosing spondylitis. The bone with ankylosing spondylitis will cover the disc and make our spine lose the flexibility to bend. It also makes our spine cannot to absorb the impact when walk or run.
So the result of my patient was good because the difference of the measurement was 6 cm, and the positive of this test is if the difference of measurement are below than 5 cm, and there we can conclude that he or she has ankylosing spondylitis disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is MUHAMAD SUGIMAN, and today I'm going to share with you guys how to diagnose cervical radiculopathy using Sperling test. The Sperling test is also called the Sperling compression test or Sperling maneuver. Cervical radiculopathy occurs when a nerve in your neck is pinched near the area where it branches away from your spinal cord. Several things can cause this, including a herniated disc or degenerative changes that happen naturally as you age. Common symptoms include pain, weakness or numbness in your arm or hand muscle. You might also feel pain across your upper back, shoulders or neck. The Sperling test will help your doctor check for cervical radiculopathy and rule out any other causes of pain. And now I'm going to share with you guys how to do the Sperling test. The Sperling test can be done while the patient sitting on a chair, just like my video, and then you slowly, gently, slightly bend the patient neck towards the side of the body where is the symptom. If the patient feel the neck pain at the left, you slightly bend to the left, and then you put your arm together, the two of your arms, and then you slowly, gently compress it. If the patient feel numbness on her arm, that means the patient is positive cervical radiculopathy.
all the tests performed were not accurate and only to get an initial impression. To get accurate and valid result, we need go to clinical tests such as X-ray or MRI.